I'm Esther Israel, and I'm a pediatrician at MassGeneral Hospital for Children and the Quality Chair of Pediatrics. I'd like to welcome all of you to our town hall this evening. Recognizing that there is a lot of concern, angst, mixed messaging going on regarding school starting this fall, we tried to pull together some local experts from MassGeneral Hospital for Children who could address concerns from multiple aspects and provide some practical advice. We're pleased to bring you this town hall entitled Info and Tools to Help Families Navigate School During COVID-19. Susan Edgman-Levitan, the Executive Director of the Stokel Center for Primary Care Innovation, will moderate this evening's town hall. She will introduce the speakers, to whom we owe a debt of gratitude for being here this evening. And I'd also like to thank Susan for all of her work in bringing this town hall to fruition. So without further ado, I will turn it over to Susan.
Thank you, Dr. Israel. So we are very, very pleased to have everyone with us tonight. We're going to be sharing a lot of information pretty quickly, but we are recording this and it will be placed on the MassGeneral Hospital YouTube channel, the MassGeneral Hospital for Children website, and probably several other sources to make it easy to access after we finish the recording. I want to share a few housekeeping rules with you before we get started, and you just got to see my husband come in with dinner. So the first thing I want to let everybody know is that we mute all participants to eliminate all the background noise. So no one will be able to join in or ask questions out loud. So we need to use the chat for that. You can view the speaker on your full screen, or you can go to the gallery view up in the upper right-hand corner to see all participants. And it's possible to go back and forth depending on whether you want to see the speaker or all the participants. If your picture becomes jumpy or out of sync, that usually is because we have so many on the Zoom. And so the best way to fix that is to click the stop video icon, that's a little video camera down in the lower left-hand corner, and that will help speed up your connection. For questions, and we really encourage you to send your questions in during the presentations, please use the chat feature, and you'll see that right in the middle of the bottom ribbon across the town hall. So click on that and send us your questions. One thing I want to alert you to is that everyone can see everything that's written in the chat. So we really don't want you to ask any personal medical questions or share any medical pictures or anything else because you'll be sharing them with a lot of people you probably don't know. If you do have specific questions or you have something you need to talk to your doctor about, we really encourage you to contact your pediatrician. And we also want to let you know that we've already gotten many specific questions about specific schools or school districts. We're not going to be able to address specific school policies or questions tonight. We're going to be sharing more general information. But if you do have questions about your child or your family specific situation, please contact your pediatrician. We're covering a lot of information, so we're going to try to be brief, but please use the chat function to ask your questions. It's now my pleasure to introduce our speakers, and they will hand off to one another, so I will not come back in until it's time for the Q&A. So we're first going to hear from Dr. Vandana Madhavan, who is the clinical director and a pediatric infectious disease specialist at MassGeneral Hospital for Children. Then we'll be hearing from Dr. Alexei Araz-Boudreau, who is the clinical director for pediatrics and also a pediatrician at our Chelsea Community Health Center, and she's the director of population health management for MassGeneral Hospital for Children. And then our last speaker will be Dr. Ode Hennon, who is the co-director of the Child Cognitive Behavioral Therapy Program in the Department of Psychiatry at MassGeneral, and she's also the director of the Child Resiliency Program at the Benson Henry Institute for Mind-Body Medicine at MassGeneral. So with that, I'm going to turn this over to Dr. Madhavan.
Thank you so much. Good evening, everyone, and thank you for joining us. In addition to being a pediatric infectious disease specialist, I'm also a primary care pediatrician and a pediatric hospitalist. Wearing all of these hats, I've cared for children with COVID-19 as well as MISC, helped develop protocols for infection control, evaluation, and treatment, done a lot of education within pediatrics and within the community. And one common thread among all this work is that information is just so rapidly evolving, and many questions remain difficult to answer. And so I am going to be talking about what we know now and what our best recommendations are now, but just want to add the caveat that information may be wrong within even a day. As of this afternoon, just to set the stage, there have been over 6.3 million cases in the US and nearly 190,000 deaths. Over 250,000 cases were diagnosed in just the past 7 days. And this is in the setting of nearly 27 million cases and nearly 900,000 deaths worldwide since SARS-CoV-2, the virus that causes COVID-19, was first identified late last year in 2019. Initial numbers in the global pandemic show that approximately 2% of cases were in children, typically defined as 0 to 18, although the exact definitions have varied. The American Academy of Pediatrics has compiled state-level data, and as of September 3rd, there were over 513,000 cases in children in the US, which is about 9.8% of all cases, so just under 10%. The exact number of pediatric cases remains difficult to calculate at the state, national, or global level due to the extreme variability of testing availability, as well as testing criteria. Most children tend to have milder respiratory disease, may have very different symptoms than adults, and so they don't automatically get referred to testing, or not have any symptoms at all. Multisystem inflammatory syndrome in children associated with coronavirus, MISC, or initially it was also called Pediatric Multisystem Inflammatory Syndrome, or PMIS, began to be identified in Europe in mid-April, approximately 1 month after initial surges of cases there, and then in New York here, and then in the rest of the country. And this is something that we are still learning a lot about. There's a wide spectrum of illness, with children typically having fever, plus respiratory, GI, or neurologic symptoms, and or rashes. They can have severe elevations in a number of inflammatory markers. They can be very severely ill, presenting with shock and requiring significant cardiac or ventilatory support, or present like Kawasaki disease, which is an inflammatory syndrome in young children that can be associated with coronary artery abnormalities. Or they can have milder symptoms, but present with much more significant laboratory anomalies. All confirmed cases have had evidence of prior infection with COVID-19 or significant exposure. And children with MISC are typically treated with different combinations of anti-inflammatory agents, such as steroids, intravenous immune globulin or antibody, or anakinra, which is another immunomodulatory agent. As of September 3rd, we've had nearly 800 confirmed cases and 16 deaths in 42 states, New York City and DC. The cases have occurred in infants up to 20 years of age, but the majority were in children 1 to 14. The vast majority had evidence of prior infection, typically 2 to 4 weeks prior, with 1% having a confirmed contact. 99% had evidence of prior infection. And just to show how this really reflects the burden of COVID-19 infection in the US, more than 70% of cases of confirmed MISC have been in Hispanic, Latino, or Black children. Here at MGHfC, our first surge of cases of COVID-19 and subsequent MISC was in the spring. But we do expect another surge, though potentially with fewer patients and over a longer period of time, depending on the exact degree of statewide intervention, such as mask wearing, social distancing, business restrictions, travel restrictions, etc. We have seen a wide variety of MISC cases, from patients requiring ECMO, which is essentially a heart-lung machine for patients not requiring surgery, to patients who have been quite well but have had very significant inflammatory markers and or cardiac dysfunction warranting treatment. Because COVID-19 acute infection doesn't tend to cause a severe illness in children, we thankfully haven't seen very significantly affected children with acute infection. But because of this evolving data, we've continued to reevaluate and update our diagnostic and treatment protocols for both COVID-19 as well as MISC with a multidisciplinary group, including infectious disease, primary care, cardiology, rheumatology, hematology, and pharmacy. We discuss cases on a daily basis, for MISC, and really are, working on incorporating recent knowledge to know how best to support and treat these children. For acute COVID-19 infection, we know that remdesivir, which is an antiviral, can be used for severe disease requiring additional cardiorespiratory support. Corticosteroids have been shown to be beneficial. That's very recent data that's come out. But many other interventions, such as hydroxychloroquine, antiretrovirals used to treat HIV, have not been shown to be helpful, and in the case of hydroxychloroquine, can be actively harmful. So again, just emphasizing the importance of really following the most up-to-date guidelines and recommendations. In terms of prevention, we'll talk more about non-medical interventions in a moment, but as everyone knows, there are numerous vaccine efforts underway with timelines to be determined as to when they will be available. So just want to set the stage about, what we know very quickly about COVID-19 in children. But as we're all making decisions about sending children back to school, there are many considerations to take into account surrounding transmission and infection prevention and ways to keep children and families safe. As I've mentioned, unlike for other respiratory viral infections such as influenza, we know that children are far less likely to develop severe disease from COVID-19 infection that is requiring hospitalization and especially ICU level support. We do know that children with underlying medical issues, including respiratory or cardiac disease or immunodeficiency, are more likely to have complications. Very young infants may be at higher risk, but this hasn't really been reported in high numbers as we see it, with influenza. And just given the rates of infection in pregnant women, we're not really seeing the appropriate matched rates in young infants. But again, due to the relatively smaller number of children with infections that have been identified thus far, it has been harder to identify specific risk factors. Again, this is a running theme. Information is evolving rapidly regarding the role of children in transmission. We do know that children are almost always infected by adults in the household and are less likely to transmit to others. They might be more likely to carry SARS-CoV-2 in non-respiratory secretions, but this is, again, evolving, just identifying SARS-CoV-2 in a respiratory specimen or in stool or, in other areas doesn't necessarily reflect infectivity to others. Due to early school closures and lower than normal group activities for children this summer, we have less information here in the US about child-to-child transmission. A recent study from Germany, however, showed that in-school transmission is rare, though it's not the best parallel to what we can expect here because cases in the community were very effectively identified, isolated, and those case contacts were traced very quickly. It's a very different situation to what we have here. We don't have that infrastructure set up to do that, and so we can't assume that low child-to-child transmission rates in another country are directly applicable here. Early studies from China and data here at MGH in March and early April showed that co-infections weren't that common, but since we haven't seen COVID-19 in the US during our peak fall and winter respiratory viral season, it's really hard to say what to expect. A recent paper authored by Dr. Lael Jonker, a pediatric pulmonology here at MGH, has gained some attention. I wanted to mention that that looked at nearly 200 patients to age 22 who were enrolled in a study to have specimens obtained. 26% were positive for SARS-CoV-2 and 9% or 18 at MISC. Symptoms were often very nonspecific and only 50% had fever. And just wanted to mention that specifically because a lot of plans include fever, measurement of fever at entry, and that doesn't necessarily rule out rule out active infection. Interestingly, in this study, viral loads in the nasopharynx, the upper respiratory tract, were higher in children in the first 2 days of symptoms, but again, that doesn't necessarily correlate to actual infectivity. Younger children had lower expression of ACE2 receptor in the lungs, which is thought to contribute to the inflammatory cascade in older patients, causing such severe acute disease. And so this is thought to be one of the reasons why children might have less severe respiratory illness. Another consideration is that people are more likely to transmit infection between 2 days prior to onset of symptoms and up to 5 to 7 days after onset. Studies in Taiwan and Singapore have analyzed confirmed cases in their context very closely to determine how cases were infected and whom they infected themselves. And this is where recommendations for when people can return to work and school have changed often, and longer periods of isolation are not required as they were earlier in the pandemic. But again, emphasizing the importance of really tracing contacts and not relying on symptom presence alone to rule out active cases. So thinking about school, Dr. Razbudro will discuss this a lot further, but just some quick considerations. We know that online learning can be less effective in younger children for whom the socialization aspect of school is even more important. Other benefits of in-person school include meals, mental health resources, and identification of struggling families. And this has lent support for different recommendations with prioritization of in-person school for younger children and those at risk, for example, those not having adequate resources at home or with additional learning challenges. Schools are ensuring safe learning environments with appropriate distancing and room capacity considerations. Plexiglass barriers can help reinforce distancing, but aren't a measure in and of themselves. They are ensuring adequate ventilation in spaces to minimize respiratory droplet transmission. You may have heard of cases of transmission at larger distances in restaurants that did not have adequate ventilation. Thinking about specific activities, for example, singing and contact sports are riskier than playing a stringed instrument with appropriate spacing. And it's also important to think about what we can all do. We know that masks work, as do hand hygiene and physical distancing. We have data from here at MassGeneral Brigham showing that after implementation of universal masking policy for staff, there were no hospital-acquired infections among employees. You may have read about the hairstylists in Kansas City who worked with dozens of clients while not just having active COVID-19 infection, but having active symptoms. But because they wore masks, they didn't infect anyone. We use eye protection in the healthcare setting as staff might be caring for patients who cannot wear a mask or have to remove a mask due to healthcare exams and procedures, but they're not currently recommended in other situations. It's important to model all of this for children as something that we're all doing rather than something that they're doing to save teachers or grandparents and not put them to not put undue pressure on them. It's important to model and practice correct and frequent hand washing, mask wearing, physical distancing. And I just want to acknowledge that it's important to acknowledge that this is hard and it's important to find ways to find silver linings for all of us and emphasizing that it's hard, but there can be some positive moments. I want to end with another consideration about what we've already seen locally at the state level, in other states and at the national level, based on CDC and some local data showing that there was decreased ordering and decreased administration of routine childhood vaccinations. So it's very important to ensure that children are up to date with routine immunizations as well as a seasonal influenza vaccine. While we are focused on COVID-19, it can be easy to forget that a cough could be due to measles or pertussis while we have under-immunization. So there are no easy answers to all of this. I'll be happy to answer things in the Q&A later, but just to remember that we are all in this together and we can all do this together. Thank you, and I'll pass this to Dr. Alexia Rouse-Boudreau. Thank you.
Hello, it's my pleasure to be with you all tonight. And Donna, thank you for setting us up with sort of the latest science. So there are three things I hope that you'll remember from many of the points that I'll bring up. because this is a very difficult time, and I'm talking to you as much as a primary care pediatrician as the mother of 3 kids in 2 different schools and trying to juggle all that. And the first is that this is an imperfect, evolving journey we are all on with our children. And I use the word imperfect and evolving those words very specifically. The second point is to make sure you are getting your child's perspective. Ask your children what excites them about starting school this year and what are some of the challenges that they can foresee. And the third point is to make time to organize and set a schedule for you and your family and to communicate that plan. And those would be the 3 things I hope you can take away from the next 10 minutes or so. So as Dr. Medhaven described, there is no real perfect solution right now. Both in school and online learning pose new demands. To begin with, in school is not what we've always known, but comes with new restrictions and face coverings and seating assignments, things our children have not had to function with in school before. And online comes with executive functioning skills that really most people don't have to exercise until they enter into college. Having said that, many of us don't have a choice, and if we are lucky to have a choice, I think there's a few things we want to consider in making that choice. One is we need to balance community rates, and what might be right for the entire community might differ. And this will also differ from one community to another. In Massachusetts, yesterday's dashboard reported a positivity rate of 1.6. But in some communities, the 14-day positive rate has been as high as 5%, and in others, 0%. So there is this community aspect to making this decision. The next is really individual family, and what are the current, your family risks for COVID? Who lives in your home? Who do you interact with? As well as what are the family needs for school resources? Is this a place where lunch and mental health and other provisions are quite essential for you to receive? And then there's that individual child and what their particular needs might be. And that will vary by age, development, their educational needs. And then I do think social engagement might also come into play. And all I'm trying to say is that one size does not fit all. And it can be a very difficult decision that needs to take into account these various aspects. There are tools that are coming out to help guide these conversations for you and your family. The CDC has put one out. I know that MGHfC is developing one. So using those can be helpful, as well as having these discussions with your own primary care providers. There is, at this point, no literature that has compared online learning as we are experimenting with it today with in-person classroom as we are experimenting it with today. However, what we do know is that younger kids tend to learn much better from relationships and face-to-face interactions, and that we all tend to be better experiential learners. We also know that children are very resilient, and if we can guide them, we can help bring out that resilience in any of these environments. And I'm very excited to hear Dr. Hanane's discussion that will follow. And so after this, coming to the conclusion of what your family is going to start out with, it's really time to prepare everybody for that decision and talk to your child about the modalities that they'll be experiencing and what they're going to find, what they might like if they've experienced them before about them, and what they might find challenging, and brainstorm with them. And asking some of my patients, they're worried about how they're going to remember to ask their teacher the questions that come up. And then they start thinking about, oh yeah, maybe I can email, or maybe I can write down my questions. And in this way, as they become part of the solution, you're giving them agency and some empowerment over a situation where there's very little power at an individual level. We were talking, Dr. Manavan had been talking about keeping everybody safe and mask and hand washing and social distancing. These are new activities for many of our children. And in addition to modeling, which is probably the most important aspect, it's try practicing in different settings and in different time allocations. You know, for a teenager, what does social distancing mean can be very different than from a 7-year-old who just wants to roughhouse all the time. So having those conversations and practicing what that would look like. Then, you know, during any time, September can be exciting as we get ready for school. You know, what's that new pencil case going to look like? We are acquainting ourselves with friends and teachers. Let's not forget that, right? And talk to your family and your kids about that aspect of it. And think about what have been some of those family rituals, and can you recreate them again to try and gain some sense of continuity. Keeping kids informed of what's going to happen. And I know that this is very difficult as plans can change almost on a weekly, if not daily basis sometimes. But when you're talking to your child, help them know what they can expect and what changes they might expect. So for instance, you know, yes, Mary, looks like you're going to be going to school on Thursdays and Fridays. If that changes and you're going to go to school on Monday and Tuesdays, as a family, this is what we're thinking. So as you're telling them what to expect, you're also talking about the fact that there might be changes that are coming along and that you'll be there with them to handle those changes. Creating routine is really important. This is a huge demand on how we organize ourselves and how kids need to, when they're doing the online learning, how they need to organize and plan their schoolwork. So taking the time to help them schedule out, okay, if you need to turn in your homework on Friday, where do you have to be on Tuesday, Wednesday, and Thursday so that you can accomplish that on Friday? And depending on the age of your child, having them make some of those decisions, you guiding them, just check it with you. And then fortunately, the scheduling has to go beyond classwork. Think about sleep, setting a consistent bedtime for Sunday and Wednesday, and if possible, Friday and Saturday. Can be very helpful in setting those biological rhythms. Don't forget to include meal times. You know, if when a child is in school, meal is going to happen at 10:30 in the morning, and yet when they're at home, they're not getting a meal until 1. It's very hard for the body to start gaining that rhythm, and you want to create that sense of rhythm, physiological rhythm. So schedule your meal times, and please don't forget to schedule playtime, whatever that might look like. And schedule sounds too rough, but remember to include playtime as you're organizing what the rhythm of the day is going to look like. Then there's an importance of setting external reminders, especially when you're remote. So having some dedicated space where schoolwork's going to happen. And this might mean that our kitchen table might serve as a kitchen table before 8 in the morning, be an educational space between 8:30 and 3, and then in the evening become a place where we do our bills. But as what that space is meant for, as it changes, have that environment physically change to help cue people into what it's supposed to do. And then also think about what you're wearing. I mean, we've all seen the jokes and have laughed at the half-dressed business board meeting that are happening on Zoom calls. And it is funny. For kids, it can be a little bit disorientating, right? Am I supposed to be serious now, or am I okay really that I'm just in my underwear? And it can be very helpful to sort of say, you know what, there is a dress code. Saturday morning is not the same as Wednesday morning online classes. And how do you help to give those physical cues? Also, let's not forget that regardless of the mode of education that's happening, our kids are really having different social interactions, and this might make development hard. Think about that adolescent who naturally and for their own development should be spending more time with their friends than they have in the past and figuring out who they are, not necessarily next to their parents. And we can't provide them that in the same way we used to, but can we come up with creative ways so that do have that space on their own, and yet come together and talk to you about what they've discovered during that time on their own. And again, how does your 9-year-old get time to kick a soccer ball or ride a bike, and sort of think about the social interactions. And remember that many kids have been home quite a bit, and re-engaging in society can be scary or anxious producing. You mean it wasn't okay for me to go out 2 months ago, and now I'm supposed to go out on a regular basis? And so trying helping walk them through that change. And the last thing is, for all of us, this is a very difficult time when we may have to be balancing work, whether that's with a business or organization or the work of a household, with schoolwork and schoolwork of our kids. And so remembering to give yourself and those who make up your household some grace can be very helpful. Setting some time, some dedicated time for when you're going to be able to help with schoolwork and making that known. Creating some visual prompts if sometimes you do have to have the door closed so that no one's going to interrupt during that 1-hour meeting that seems vital. And this is certainly the time to enlist the support of the entire household and other family members and friends that you have to really get us through this time together. And I'm so glad that well child care was mentioned earlier, because vaccines are important to keep us all safe and healthy. But during the well child visit, it's also a time when pediatricians are assessing physical, emotional, and social development, and we're doing screenings to see if things are changing and we might want to approach certain aspects of your child's growth in a different way. So having the time to partner with your primary care clinician is really important. And without further conversation, I really am looking forward to Dr. Hanan's presentation on resilience.
Thank you so much, Dr. Boudreau. I'm delighted to have the opportunity to share some of the things that we've been working on and thoughts that we've had about how best to support children during COVID, and especially now with this new transition back to school. So what I want to do is spend a little bit of time talking about some of the common stressors that have been arising for young people. And I'm now old enough that when I say child, I mean well through mid-20s. And I actually work a lot with adolescents and young adults. And it's turning out that that's a group that's unduly affected from a mental health perspective by COVID and all the changes. So I think it's important that we not forget that college age young adult group when we're thinking about these transitions. But I want to focus most of my time on what we can do to support young people, support kids. And moving forward, this is a marathon. So how do we help them hang in there for the next year or so? I truly believe that in the long run, most kids will be okay. We are designed to be resilient, we're designed to adapt. And just because we have not had to face this kind of situation before doesn't mean that humanity hasn't been doing this for thousands of years. And so it's definitely in the short term incredibly difficult, but in the long term, I am hopeful that most kids will come out unscathed, even if they're spending 12 hours a day on their phones or on some sort of social media platform. Maybe I have a vested interest because my kids went to Camp TikTok this summer. So, but having said that, I do think that there are a number of stressors that we need to recognize. And we've already alluded to some of them around fears of illness, both in themselves and also in family members, but also that kids are still facing all the same stressors that they did before COVID. So it's really been an additive model. So kids are still worried about school and tests and grades. They're worried about peers and social relationships. And let's remember that kids and teens are fairly egocentric. So many of them aren't even thinking so much about COVID per se, but more how COVID is impacting them. And something that we hear often from kids is it's not fair. And they're absolutely right, because it isn't fair. And helping them tolerate that, tolerate the losses, not only big losses, for example, of a family member, but the littler losses that are so important to them. The graduation, the being able to see their friends at school, the being able to hang out without needing to plan and to remember to stay 6 feet apart. All of those are significant stressors that we're asking kids to tolerate overall. And the biggest one, and it's been alluded to kind of throughout, is this idea of uncertainty, right? We are not fond of uncertainty. We like to know what's going to happen, kids and adults. So why people went and bought all the toilet paper when this first came out, because we needed something to do. This idea that all of this was happening and that there was nothing we could do is pretty intolerable. And in many ways, that's what we're having to really tolerate ourselves and have our children tolerate. And tolerate the fact that what we know or whatever we're doing now is likely to change, so that we can't just kind of hold on to how things are and assume that that's going to continue. And so I think when we're talking about resiliency, it's actually an opportunity, because this is a pretty darn good skill to develop, right? How do you bob and weave through life? The longer I'm around, the more I sort of realize that's it. That's what we do kind of on many levels, and we're being asked to do that in a big way. But it is really an opportunity to know, what are the things I can change? And if so, what do I do about that? But what are the things I can't? And how do I tolerate that when things are not at all what I had wanted, hoped, planned, assumed, and I have to completely change my perspective? And that is, I think, an opportunity that we don't want to miss with our children. So having said that, I think that there are some kids who are more likely to have much more significant mental health concerns than others. And so, what we're seeing overall is more heightened anxiety and some worry, some withdrawal. So kids spending more time in their rooms, more time on social media. And that is very normal. We do start to get concerned, however, if that's starting to interfere. So it's one thing if your child is a little bit more listless, less engaged, sleeping in, but if the child is spending all day in bed, if the child has lost interest in all of the things that they used to be interested in, doesn't want to do anything, if the child is expressing kind of thoughts about death or dying in a way that's concerning, that is a different level of concern. And obviously we want to make sure to seek appropriate care for a child where you may be concerned. But certainly I think most kids are expressing milder levels of distress, and we want to validate and acknowledge that. It's a completely understandable reaction to an unusual situation. So what can we do? Well, I think the first thing is to think about, as adults, how we're modeling. And we've talked about modeling of hand washing and mask wearing and social distancing, but we also want to model coping. And so when we're talking about modeling coping, it's not pretending that everything is great and that you've got it all figured out. It actually turns out that's not so helpful for kids. But what it is modeling something that you're struggling with, for example, something you may be worried about, and showing how you are actively managing that worry, that anxiety. Whether it's problem solving, okay, I'm not sure how I'm going to get onto this Zoom call. I've never used Zoom before, so what am I going to do? Or it may be modeling acceptance and sort of more mindfulness practices, which I'll talk a little bit about in a second, how you're breathing and taking care of yourself. So really walking kids through those processes. And it's also being careful that we're not modeling things that are unhelpful. And it's very hard because all of our emotions are heightened, especially now around the return to school. And so I'm seeing a lot of dialogue and conversation about, the schools don't know what they're doing, or this teacher isn't doing this. And we have to remember that kids are listening to everything we say, and that those kinds of conversations are incredibly anxiety provoking for them and leave them with very little recourse. So I think it's not clear that there's a good answer, and it's not clear that one size fits all. And I think we have to exemplify a little bit of compassion and kindness, because otherwise we're sending our kids in to work with individuals that they now don't feel confident about. I don't know what the year will bring. I do think that it's going to be very different from how it was last spring. And I think that's part of the anxiety, is that last spring was so incredibly challenging for everyone. And we're walking into the fall with that experience experience. And so I do suspect that whether it's online or hybrid or in person, it's going to be very different. It is going to be more structured. It is going to be much more supported. I'm sure there are many children for whom it is still going to be quite difficult, and we're going to have to adapt as we go and figure things out, right? Because that's really what we're doing. We're figuring this out as we go. And allowing children to have that be reflected, that all the adults don't have all the answers, but we're going to hang in there with you, and we're going to figure it out as a team. Your teachers, your parents, your peers, we got this. We're going to mess up. It's going to be ugly sometimes, but we're going to figure this out, and in the end, we're going to get through it. I think that's really the kind of message that we want to teach kids, and so we want to make sure that what we do and what we say accords with that. Certainly, we can have concerns that we express to each other, and we want to, as Dr. Boudreau say, really make sure that we're listening to the kids' concerns and asking them what they're worried about, because it may be something completely different from what you assumed. And so you want to make sure you're not solving the wrong problem by assuming that you know what the issue is. We want to give them a voice, and we want to check in with them regularly, and check in about the things that are going well, the things they are excited about, that they're looking forward to, as Dr. Boudreau was saying, and the things that they're struggling with. And the idea behind resilience is that, so resiliency is not the absence of fear, it's not the absence of distress, it's experiencing that and kind of keeping going. It's kind of finding ways to flexibly adapt when those distress signals are arising. And so we want to acknowledge that it's really okay for kids to be nervous and anxious and unsure and worried, and help them think through, what can I do to cope with this? How can I use that emotion or those emotions as a signal to cope, as opposed to a signal to avoid, withdraw, run away, and hide? And so a lot of the work that we've been doing has been about teaching kids skills and tools that they can use to manage stress in all circumstances, including COVID. And there are a number of resources that will get posted and help with some of the things that I'm talking about. Our department has a number of online resources that you can access that can help reinforce some of this. But some of the basic skills about with kids have to do with, how do you pay attention to the clues that your body is giving you? So noticing, what are the symptoms that you get when you are starting to get anxious or stressed, and how can we use those symptoms as a cue to cope? So, butterflies in my stomach, or I'm having trouble sleeping, or I don't want to get out of bed in the morning, or I'm cranky and fighty. I fight more with my siblings, which has been one of the lovelier parts of this entire experience. They got much closer, but in ways that involve fighting, apparently, but never mind. So really kind of thinking about, what are all of the things that your body does that tell you, oh, I'm stressed? And then what can you do to actively manage that stress? And that can be, at a core, anything that absorbs your attention fully and gives your body and your brain just a moment of respite. So certainly we talk a lot about breathing and mindfulness approaches, but it can also be playing basketball, shooting hoops. It can be petting your animal. It can be going for a walk. So anything, paying attention to what are the moments of well-being, the moments where I'm not worrying about 10 things at once, and I'm just focused on what's happening. And a lot of those tend to involve repetition, because it turns out that repetition really kind of helps the brain calm down, right? It helps reduce the stress response. So that's why when people talk about running or music or all of these things where you're sensorily involved, and it doesn't have to be long. It doesn't have to be meditating for an hour. It can be just a few minutes here and there. The best tools are the ones that you can use, right? And so really thinking about little ways to start to sneak that in and to practice them. So creating these routines and habits, as Dr. Boudreau was saying, that include some of these tools, some of these ways to just decrease that physical arousal. Another tool that we work a lot with kids around are paying attention to your thought patterns. So what we know is that people's reactions to situations are dependent on how they interpret or think about the situation. So in the very same situation, two people will have completely different reactions because they're thinking about it very differently. And we know that there are some thought patterns that are unhelpful that are associated with more anxiety or depression or anger. And there are thought patterns that can promote coping and self-efficacy and help you feel more competent. So this isn't just thinking happy thoughts, but what it is identifying those negative thoughts, that negative coach in your head that says, you can't do this, you'll never make it, why did you mess up, this is terrible, et cetera, et cetera. Paying attention to that coach and coming up with a more helpful way of coaching yourself. This is hard, but if I stick with it, I'll get it. I've done this before, I can do it again. I'm afraid, but it'll get easier if I keep going. Whatever it is. So really actively challenging these negative thoughts and coming up with more helpful thoughts. And again, giving kids the opportunity to practice those thoughts in situations and really fostering their facing the things that are challenging for them and not avoiding them. So those are just a couple of the tools. There are many, many more. And again, I'm happy to refer you to our websites. We're also running groups to promote some of these skills online. It's actually been a really great way to reach kids who may not have been able to come in person. And I'm happy to answer any questions about any of these or other things as well.
Thank you. Dr. Hennon, before we get started with questions, I'm going to ask you if you could maybe put your website into the chat so that people have that and they can copy it.
Yeah.
And I also want to encourage everyone to submit questions. We had one, and that was, will a transcript of this be available? Not the exact transcript, but we are putting together a handout that will summarize everything you've heard tonight that we'll be able to share with the recording. I have a question actually for Dr. Arouse-Boudreau, and that is, you've talked about the importance, and so did Dr. Madhavan, of children keeping up with their immunizations. Can you say a little bit about what we're doing in our practices to make sure that the care is safe when you do need to come in for any kind of acute problem or to get your immunizations or well child care or anything else that's important if you're a child?
Certainly. So keeping our patients and our staff safe is one of the first priorities that we have had. And in this have sort of put in various levels of what would consider safety control. In the first is really limiting the number of people that are on site. That is both for staff, patients, and visitors. And hence, we do have some more strict visitation guidelines and practices. You'll find those in your practice, but this is all being done to make sure that there are fewer people who are coming. Then masking. Whenever you come into one of our doors, you'll see that there are masks, and we ask people to wear our hospital masks as opposed to their own personal ones, and hand hygiene before putting it on. And then we've worked on our workflows, physical workflows, to minimize how people are passing each other, time that is spent in the waiting room. And these are some of the measures that we've been taking to make sure things are really safe and comfortable. And it was hard, I think, even for clinicians to think about going back at first. Mm-hmm. And I am thoroughly convinced right now that I am safer, even in clinics where I am evaluating respiratory illness, than I might be in public areas in the community. Because of the practices that we put into place. Dr. Madhavan, anything else you'd like to add? You've been an integral part in making sure that we are all safe at work.
Yeah, I just want to iterate all of that. We have a campaign, Clean, Screen, Protect, and so rooms are being cleaned. There are fewer patients per room per hour, so that adequate cleaning of surfaces, can be done. Patients are screened when they're being scheduled. Do they need to come in? Can this be done virtually? They're being screened immediately before the visit, and the day of, they're being screened as they're coming in to make sure that they are being taken care of in the safest place for their needs at that time. And we're all protecting ourselves, just like you mentioned, with universal mask wearing, hospital masks for both staff and for patients and their families as well. And so I would also echo, I was nodding vigorously. I also feel safest. I tell this to my patients all the time. I tell this to family members that I feel safest when I'm in the hospital. They worry about me. My family worries about me. And I'm like, no, that's where I'm safest. And this is why I'm not doing very much out and about.
That's great. That's great. I had another question for Dr. Rose Boudreau. Can you say a little bit about how to get virtual visits or how to get virtual care if that's something that people would like to do? We are providing, I think we just had our 1 millionth virtual visit at MassGeneral Brigham across our whole system. And we're talking about that a lot with our adult patients, but I want to make sure that our families understand how to do that as well.
It is. It starts out with a call to your clinician's office. Then there's various platforms. The simplest and most straightforward is if you're on Gateway, there's a very special Zoom account that allows us to do virtual visits that you can access to it. And we do have some patients who have trouble with Patient Gateway for one reason or another. And so then every practice also has other platforms with which they can reach their patients for virtual visits. So it really is a phone call to your practice. And if a virtual visit is what's right for the care that you are requesting, the practice will work with you to make sure that you get it.
Okay. Dr. Israel, is there anything that you'd like to add?
So I think the only, regarding your question about the vaccines and vaccinating, we're really committed to vaccinating as many people as we can to catch up on the vaccinations that they may have missed during that spring, as well as particularly the flu vaccine. And so we have plans to rev up our vaccination, even if you come in as an inpatient, to make sure that you get it. If you come to the emergency department for another visit for some other things to get vaccinated, we're trying to really rev up. If you come in for any other problem, is to try to take every opportunity we can to vaccinate. And so, and there will be vaccine clinics at Mass General Hospital that will be vaccinating patients. So I think we just got the flu vaccine in, or we're in the midst of getting it. And so hopefully we will be able to catch everybody up, but we're really committed to trying to vaccinate everybody.
Great. And
Great.
Dr. Madhavan, I don't want to put you on the spot, but I know that in some of our adult town halls, we get a lot of questions about what do we know about immunity? And I know that's not an easy answer, but maybe if you could just say a few words about that, because I think that's especially confusing for people.
And I will say it's also confusing to me since we know, very little, because we are, while we are seeing that in, there have been a lot of different studies. When I give larger talks, I often include this data as well, showing that in some really high, hard hit communities, serology, during the peak was as high as 30–40%, showing that a lot of people had antibodies at that time. We also know that people start forming antibodies to COVID-19 within a week of having an infection, and so that can just reflect recent infection. But we don't really have enough information as to how long those antibodies last. And even if they are detected, are they actually protective? There does seem to be, growing evidence that having a more serious infection certainly protects you. You have more easily detectable levels of antibodies, and that might provide longer term protection. But what does that mean for all the people with very asymptomatic or mild infections? Clearly, we don't have the testing. We have not had the testing infrastructure put into place in this country to really assess how many of our, how much of our population has been infected. And so this is really, this is the $1 million question that I wish I had more information about. So
I have another question for you.
I also answered, there was a question that came up in the chat that was just sent to me privately, so I just wanted to acknowledge here too. It was, what symptoms should we be aware of in children who may have a milder case of MISC, as many children who are either asymptomatic or have mild or atypical symptoms with COVID? And that's a great question. As we are seeing more cases here in the US and have really started being able to look at a larger cohort, one of the things is really a prolonged fever. While the fever and the and part is there's much more variability, whether it's more GI symptoms or respiratory symptoms, whether it's a rash or swollen, hands or feet, or even, neurologic changes. It's really prolonged fever. Initially, when MISC was first identified, even having a day of fever meant you could be evaluated, and that meant a lot of people with just routine viruses are being checked. But prolonged fever is something to really, look for. But if you have questions, please, discuss with your pediatrician, who can really look at all of the information to decide, if your child needs more testing.
Okay, I'm going to ask you one other question that came in, is if your child is attending school in person, is it important that the families do regular COVID screening?
So I would say that screening in terms of thinking about symptoms, yes, but not testing. Again, testing availability, there are a lot of different tests that are becoming more available, and there's going to be different levels of accuracy in terms of how sensitive and specific these tests might be. And I would say that it's much more important to continue the measures that we know do limit spread, and not rely too much on just thinking about testing, but thinking about looking for symptoms, but also minimizing potential exposures by doing all the things that we've been talking about.
Okay. Dr. Hennon, we have a question about how do you keep kids motivated to learn while they're remote? And this person's asking on behalf of her husband, who is a teacher.
That my heart goes out to the teachers who are going to have to figure this out on a grand scale. Well, so I suspect that for the most part, it's the relationship. It's the same thing that keeps kids motivated in person. So that the challenge is, how do you build a relationship on Zoom? It's a little bit harder, but not impossible. And so really thinking about how can you really still get to know the kids in the class, and know what works for each of them, and know their individual differences, in the same way that teachers do all the time in person. And I do think that teachers are being very thoughtful about how to do that, and how to break up the day for those kids who are online fully. So having shorter classes, having a variety of activities so that kids aren't just on Zoom for 6 hours in a row, having ways for them to engage with each other and build relationships in the classroom, finding ways to have more hands-on experiential learning, even if they are remote. So I think all of the same things that they do all the time, they can do, or we'll figure out how to do online.
Okay. I think we've got time for one last question, and that is about, what about testing a 12-year-old playing basketball? And I assume that's playing basketball outside. Or
right, yeah, and
really playing basketball.
Right. I think this is something where a discussion with your child's pediatrician is definitely warranted to think about the exact details. Certainly NBA players in the bubble in Orlando is one thing. Playing basketball outside, one time, versus a league where there's a lot of, restrictions put into place about, screening for symptoms and, limiting the number of people, who are around, limiting the frequency of practices and games, et cetera. And so I think there are enough variables there. And as I alluded to, every activity really needs to be thought about, differently. Singing is different than playing a stringed instrument versus playing a wind instrument, and, et cetera. And so I think this is where, group discussions and, with the input of your child's pediatrician can be really important.
All right, thank you. I want to thank all of our presenters tonight. I learned a lot. Dr. Hennon, I have to say, I felt weight lifting off my shoulders when you told us earlier that kids are resilient and we're all going to get through this. So I really thank you for sharing that and all of the other incredibly helpful information. So I am going to turn this over to Dr. Israel to tuck everybody in and say good night.
Good night, everybody. No, but thank you. Thank you to all of you who joined us. And as Susan already said, we are looking forward to having a sort of a handout based on the conversation. And it will be on our website and I think on our Facebook site. And if I stay safe, really stay safe and enjoy your children, and your children should enjoy you. Have a wonderful fall, and good night.
Thank you. And thank you to all your thank yous. So good night, everyone. Sleep well.
Good night.
Thank you, and good night.
Good night.
Good night.